I think.
Okay, so stop right there. That's probably number one. You want to have a relationship with the surgeon, because if you are able to have that relationship, you can ask the questions, because some of it might be surgeon specific, and you can start to collaborate by this as, hey, you just operated on my patient. It looks like you did a great job. They're having some tightness in a couple spots. I'd like to treat them. What do you think? And it can help to, it's an opportunity to build the relationship with the surgeon.
I think for us too, from a mechanical standpoint, the type of surgery that you did or are going to do is really important, whether it be a fusion or a disc replacement where you're trying to preserve motion and all the other connective tissues that are involved around that decision.
Yeah. So number one, I think to answer this question, number one, you want the relationship with the surgeon. Number two, you need to know what surgery they did. Did they do a discectomy? Did they do a fusion? Was it minimally invasive? Was it open? Is it a motion preserving surgery? And so having understanding of what surgery was done and what that surgery entailed is critical to know how to treat them postoperatively.
From a standpoint of a chiropractor, when we do that treatment, if it is depending on the levels, let's just take a fusion, for instance, I'm going to need to be focusing on the adjacent segments afterwards and what stress is going to be. Now, I know from working with you, 6 weeks approximately after surgery, you're ordering x-rays. And that's important for us too, because we can see what has changed. You're looking for a certain aspect of the surgery. We're looking for the certain things biomechanically, what has changed, so that we can address it, because you may fuse a segment, but 2 areas above it may change. And I think it's vital. That's why we want to know.
And that's exactly where I think your value add is. So you understand what surgery is done. There's some specific healing ramifications of a particular surgery. Say they had an open lumbar fusion, there's quite a bit of tissue to heal there. If they've had a disc replacement, you're needing the bone and the titanium coating of that disc replacement to integrate with each other. So there's a time period there where it's maybe has a risk of migrating or what have you. But with each surgery and with each underlying condition, you're going to be looking at the biomechanics. What are the adjacent levels doing, and what are the distant levels doing? And that's where I think there's such a value to having the patients coming back to the chiropractor and seeking care, not so much at the level of surgery, but beyond the level of surgery and seeing the big picture, right? And I think that we could do better as surgeons to encourage our patients actually to go back to the chiropractor for that very reason.
What are the time frame of the hardware migrating? Like, what are some specific things that the patient may do, or have you seen in your career that could harm that? Or
that's a good question. So with disc replacement, you're looking at a few weeks for the hardware to integrate with the bone. Once a disc replacement has settled into the disc, and it's probably 4 to 6 weeks, it's not going to move unless there's some sort of osteolysis or some rare kind of problem, infection that comes down the road. With fusions, the fusion is solid from the beginning because of the hardware. The hardware actually loosens over time, and you're hoping that the fusion takes over. And that process is probably anywhere between 6 to 12 months.
Okay. Another question for me, and I get this asked from other chiropractors around the world, is what are some of the signs or symptoms that you may see that you probably, for lack of a better word, don't see because they've been discharged, and then maybe like a infection or something may arise? What are some things that we can see, be alerted to? Because sometimes I see these patients a week after. They just want to come in, like, I can move, but I'm stiff. Or what are some things that could be some red flags I should look for?
So that's a question that probably requires its own conversation, right? But I think the point I would make there is that if you have an understanding of the post-surgical issues that arise at the different time points, you can be more involved in the care. Steve came up to
Yep.
me. He's a nurse practitioner now, and he's in home health. He's been in home health and in nursing for many years. And his question to me was, can I manage these postoperative patients for you and take that load off of your team? And I was like, 100%.
Please.
And why? Because he knows what he's doing.
Yeah.
And he can totally help us because we're buried.
Yeah.
And the message to the chiropractic community is learn what the postoperative period is like, because you may be able to help alert the surgeon to an issue that he needs to or she needs to look at, and also help counsel the patient to say, oh, that's actually normal. What you're experiencing is expected, and this is what we're going to do about it. So gaining that expertise in the postoperative period, whether it's knowing when and how to treat from a chiropractic manipulation standpoint, or just understanding what surgery they had, what the healing times are like, and what the potential complications are, and how to identify those, can really help you integrate with your surgeons in your community.
From a manipulation standpoint, instrumentation that we have or can use is really important, and the reason why there's so many things going on with the connective tissue around it, muscles, soreness, different aspects of what's happened after surgery. I recommend that being used for a manipulation you'd see with your hands or something, but good information.
Yeah.